Let me ask you something. If air is entering the lungs and blood is flowing through the lungs, why would oxygen levels ever drop? It seems simple, right? Air comes in, blood passes by, oxygen diffuses. So what goes wrong? The answer is something called ventilation-perfusion mismatch. And if you understand this concept clearly, you will understand hypoxemia, pulmonary embolism, COPD, pneumonia, and many exam questions. Let's break this down slowly and logically. We'll start with definitions, then understand the normal V/Q ratio. Then we'll explore two extremes, dead space and shunt. And finally, we'll connect everything clinically. Stay with me. This becomes very simple when seen step by step. Ventilation simply means air reaching the alveoli. Not just breathing in, but air actually reaching the gas exchange units. Because air sitting in the trachea does nothing. It must reach the alveoli. That is ventilation. Perfusion means blood reaching the pulmonary capillaries. So now think carefully. For oxygen exchange, we need air in alveoli, blood in capillaries. Both must meet. If one is missing, oxygen transfer fails. This balance is called the V/Q relationship. In a normal adult, ventilation is about 4 liters per minute. Perfusion is about 5 liters per minute. So the V/Q ratio is approximately 0.8, not exactly 1, and that's normal. Now here's something important. Different parts of the lung have different V/Q ratios. The apex has higher V/Q, the base has lower V/Q. That alone is an exam favorite. Ventilation-perfusion mismatch simply means ventilation and perfusion are not properly matched. Either air is present but blood is not, or blood is present but air is not. And these two extremes have names, dead space and shunt. Let's take them one at a time. Dead space means air is reaching alveoli, but blood is not reaching them, so oxygen is there. But there is no blood to carry it, it's wasted ventilation. Think about pulmonary embolism. A clot blocks pulmonary blood flow. Air still enters alveoli, but perfusion stops. So ventilation divided by 0 becomes very high. That is dead space physiology. Now pause. Ask yourself, will oxygen therapy help here? Yes, because alveoli are still open. Blood flow just needs improvement. Now the opposite. Shunt means blood is flowing, but air is not reaching alveoli. The alveoli may be filled with fluid or collapsed, so blood passes through without picking up oxygen. This is seen in pneumonia, in ARDS, in severe atelectasis. Now here's the critical concept. Will oxygen therapy fully correct a shunt? No, because the alveoli are not ventilated. More oxygen outside does not help if air cannot enter. This is a very common exam question. Let's reinforce this. Dead space is air without blood. Shunt is blood without air. Dead space improves with oxygen therapy. Shunt responds poorly to oxygen therapy. If you remember this difference, you will solve many MCQs correctly. One more important concept, the A gradient. It measures the difference between oxygen in alveoli and oxygen in arterial blood. In ventilation-perfusion mismatch, this gradient increases because oxygen is present in alveoli, but not effectively transferred to blood. This is a high-yield exam point.
Let's summarize slowly. Normal ventilation-perfusion ratio is about 0.8. Dead space means ventilation without perfusion. Shunt means perfusion without ventilation. Dead space improves with oxygen. Shunt does not improve well with oxygen. If you truly understand this balance, you understand the physiology behind hypoxemia, and that is powerful.